This project is brought to you by Group 6, Caroline Ennis, Akelia Hypolite, Kayla Simmons, and Katie Swain.
Hi, Dr. Brown. Today we're going to be presenting on Pick's disease. Pick's disease is a unique form of dementia that causes frontal and temporal anterior lobes of the brain to shrink. And we have a picture to show some of the atrophy of the brain that comes from Pick's disease. Okay, Pick's disease is currently classified as frontotemporal dementia, or better known as FTD. This variant of FTD includes Pick's disease, primary progressive aphasia, and semantic dementia. The classifications of this disorder have been debated over for more than a century. Originally, the Pick's disease referred to the pathologically heterogeneous cases that were circumscribed frontotemporal atrophy. Now Pick's disease is used only for cases that reveal tau-positive Pick bodies. Some of the causes for Pick's disease include the results of a buildup of the protein called tau that are in the affected areas of the brain. Pick bodies and Pick cells contain tau. This protein is found in all nerve cells. People having this diagnosis of Pick's disease can have an abnormal amount or type of this protein. The exact cause of this disease is not known, but there is evidence of genetic predisposition with some cases of this disease. And then I also have found a blog site that offers support systems for families dealing with Pick's disease and persons who have been diagnosed with Pick's disease. A really interesting post that I read was about looking ahead when somebody is diagnosed with Pick's disease. Another interesting part of the blog was the fact that families need to think about long-term insurances to help with the cost of somebody who has Pick's disease. Another interesting thing was that people who are diagnosed with Pick's disease have a tendency to spend exorbitant amounts of money, and that's kind of one of the early signs, is to make sure that they're spending it on smaller items and not larger items and blowing their money. The rest of this blog talks a lot about persons who have Pick's disease and have eating issues, which is common with anybody who has dementia, but especially with this form of dementia. If anybody would like any more information about this website, you can go to www.ftds.org/general-information.htm.
The onset of symptoms of Pick's disease typically occurs in the mid-50s to early 60s. The symptoms start gradually and progress over time. Pick's disease affects thinking, language, and problem solving. The hallmark symptoms are a progressive decline in behavior and language capability, which develop relatively early. There is also often a loss of inhibition, difficulty with speech, and increased muscle rigidity. In the late stages of the disease, immobility, incontinence, and mutism may also occur. As it is defined today, the symptoms of Pick's disease fall into two clinical patterns that involve either changes in behavior or problems with language. These symptoms can include behavioral changes, which would be the inability to function or interact in social or personal situations, withdrawal from social interaction, compulsive behaviors, or problems with personal hygiene. Some emotional changes that may occur would include failure to show emotional warmth, concern, empathy, and sympathy, abrupt mood changes, decreased interest in daily living activities, or not caring about events or environment. Some language problems that may occur include shrinking vocabulary, weak or uncoordinated speech sounds, difficulty speaking or understanding speech, and difficulty finding words. Some neurological issues that may occur include weakness, increased muscle tone, memory loss, or movement and coordination difficulties.
Hi, this is Caroline Ennis, and I'm going to be talking about the diagnosis of Pick's disease. Currently, the only way to diagnose Pick's disease for certain is through biopsy of the brain. A biopsy involves removing part of the brain to conduct tests on it, and the only way a doctor could do that is after death or post-mortem. A doctor can ask questions and do certain tests, however, that they may give significant hypothesis to whether someone may have the disease. Some of these questions and tests include things like questions about medical history, symptoms and behavior, tests of brain function, usually controlled by the lobes affected by Pick's disease, lab tests to rule out metabolic causes of dementia, an EKG to check the electrical activity of the brain, a CT scan and or MRI to look for the tissue lost in the brain, tests of the senses like thinking, reasoning, and motor function, psychological tests, and a test of the fluid in the spinal cord. Now, currently the best methods for reaching a probable diagnosis involve careful symptomatic evaluation together with neuroimaging procedure results. These techniques can help doctors figure out whether it is likely to be Pick's disease or something related to Alzheimer's disease. Physicians focus specifically on 5 distinct traits to diagnose a patient with Pick's disease. A patient must have at least 3 of the 5 traits, which are onset before age 65, an initial personality change, loss of normal controls like gluttony or hypersexuality, lack of inhibition or roaming behavior.
Hi, my name is Akelia Hypolite, and I will be reviewing treatment options for individuals with Pick's disease. Pick's disease is an incurable degenerative disease. However, some of the symptoms are treatable. Memantine, also used to treat individuals with Alzheimer's, may be used to slow down the cognitive decline by decreasing the breakdown of certain transmitters in the brain. Other medications, including antidepressants and antipsychotics, may be used to control aggressive, dangerous, or agitative behavior that is associated with the disease. Depending on the severity, the patient may need monitoring, help with personal hygiene, and daily self-care. As the disease progresses, there may be a need for around-the-clock care, monitoring at home, or in a skilled nursing care facility. Family counseling can help the person cope with the changes needed for home care. It has also been found that rewarding positive behaviors such as patience or good hygiene, exercising regularly, or getting adequate amount of sleep helps to maximize cognitive performance. Speech therapy may help address difficulties in communication during the early stages of the disease. Suggested steps LCPs should take before beginning speech therapy treatment. Screen your patient. Screening is recommended for all individuals who have a condition that increases their risk for cognitive communicative problems. Assess your patient. Assessment is described as a process in which strengths and deficits related to cognitive problems are evaluated. Have positive energy. Clinicians should try to design interventions that will evoke a positive emotion in the client. Set realistic goals. To ensure relevance and appropriateness of treatment for the patient, decisions about goals, techniques, and stimuli must be made in collaboration with the patient, their caregivers, and other healthcare professionals. Train the caregiver. Caregiver training is essential to facilitate optimal outcomes for individuals with cognitive disabilities. Suggested speech therapy treatment strategies. Assessment is ongoing. During therapy sessions, conducting follow-ups is recommended to monitor the patient's cognitive communicative status and to ensure appropriate intervention and support. Incorporate signs. Speech clinicians have used linguistic stimuli such as large print signs to indicate locations of importance, such as restrooms, bedrooms, or kitchens. Reality orientation, which reinforces environmental and other cues, may help to reduce disorientation. Create a home-like environment. Increasing lighting, decreasing ambient noise, creating a culturally appropriate environment, and developing familiar routines are recommended for improving cognitive skills.
This is the end of our presentation. We just want to say thank you, Dr. Brown, for this wonderful semester, and we hope you're doing well with your baby, and we can't wait to see you soon.